everyone. My name is Jada Wilkerson. Along with my group members, there's Kiana and Michaela, and we are Group 4. We will be presenting our strategic plan on reducing racial disparities and maternal mortality among African American women by improving prenatal care access and healthcare equity. First and foremost, maternal mortality remains one of the most significant public health challenges in the United States. Although many pregnancy-related deaths are preventable, African American women continue to experience much higher rates of maternal death than other racial groups. Today, we will discuss why this issue exists, the factors contributing to it, and the strategies our program proposes to improve maternal health outcomes and promote healthcare equity. Okay, so let's go ahead and move into the problem. Maternal mortality refers to pregnancy-related deaths that occur during pregnancy or within 1 year after giving birth. This is a serious public health concern because many of these deaths can be prevented through early intervention and access to quality health care. Pregnancy places significant demands on several body systems. The reproductive system, of course, supports pregnancy, childbirth, and postpartum recovery, while the cardiovascular system works much harder to meet the increased needs of both the mother and the developing baby. The placenta also plays a critical role by providing oxygen and nutrients to the fetus. Because pregnancy affects so many body systems, regular prenatal care is essential for monitoring both the mother's and the baby's health and identifying complications before they become life-threatening. Unfortunately, African American women are disproportionately affected by maternal mortality, making this an urgent issue that requires targeted public health interventions. Now moving on to the background and significance. When we look at the data, the disparities become even more concerning. Black women are approximately 3 times more likely to die from pregnancy-related causes than women of any other racial groups, despite many of these deaths being preventable. Additionally, the United States has a higher maternal mortality rate than many other developed countries. Several factors contribute to these disparities: delayed access to prenatal care, structural racism within healthcare systems, implicit bias among healthcare providers, chronic health conditions like congestive heart failure, and limited access to healthcare services all increase the risk of poor maternal outcomes. This is why action is necessary. By improving access, equitable, high-quality prenatal care, we can reduce preventable maternal deaths, improve health outcome for both mothers and babies, and move closer toward achieving maternal health equity. So why did we choose this intervention? There are several medical conditions that commonly contribute to maternal mortality. These include severe hemorrhage, hypertensive disorders, infections, cardiomyopathy, and blood clots. Some warning signs and symptoms that require immediate medical attention include severe headaches, vision changes, heavy bleeding, high blood pressure, and of course, chest pain. Recognizing these symptoms early can be life-saving. Healthcare providers diagnose these conditions through routine prenatal screenings, blood pressure monitoring, blood tests, ultrasounds, and urinalysis. Current treatments depend on the underlying condition, but may include blood transfusions, antibiotics, blood pressure medications, magnesium sulfate, and mental health support when needed. These medical interventions are most effective when women receive consistent prenatal care early in pregnancy, reinforcing why improving access to care is such an important part of our strategic plan.
Hi everyone, my name is Kiana, and for this part of our presentation, I'll be discussing the goals and Hi everyone, my name To reach to reach our first objective, we plan to introduce a community maternal health navigating program. These navigators will work one on one with pregnant women by helping them schedule appointments, arranging transportation if needed, enrolling in health insurance, and connect with them on the importance of community resources like housing assisting and nutritional programs and also mental health services. The program will also be hosting monthly community workshops in partnership with the local churches, health centers, and community organizations. The workshops will educate women about the importance of early prenatal care, healthy pregnancy habits, warning signs during pregnancy, and resources that are available for their support, both during their pregnancy and after. They will also allow women to schedule prenatal appointments on site. To reach to reach um, our second objective focuses on improving the quality of care that the women are receiving. Healthcare providers participating in the program will complete annual training on implicit bias and cultural competence. This training will help providers recognize unconscious bias and communication more effective with the patients and providing respectful maternity care. Finally, we will participate in patient feedback surveys after prenatal visits to learn about the women's experience, like the communication, their trust, the respect, and the overall quality of care. Program leaders will review the feedback every month or every few months to identify areas for improvement and ensure the program continues to provide equitable care for African American women. Together, all these strategies will aim to improve maternal health outcomes and help reduce preventable, and they will help reduce preventable maternal deaths. Um,
Now, I'll be talking about our program and how we would actually implement it in the community. Our main goal is to increase access to early prenatal care because we know that care during the first trimester can make all the difference for the mother and the baby for the rest of the pregnancy. One of the biggest part of our program is the Community Maternal Health Navigator program. These navigators will help these women schedule prenatal appointments, transportation to their appointments, enroll in health services like Medicaid and WIC, nutrition programs, mental health services, instead of just expecting these women to know how to go into this stuff with knowing basically nothing. We're giving them someone who can guide them through the process. We also included monthly prenatal education workshops where women can learn about their pregnancy habits, warning signs during pregnancy, and the importance of receiving early prenatal care. These workshops would also give women the opportunity to schedule appointments and ask questions in a more supportive environment. Another important part of our program is the annual implicit bias training and cultural competency training for healthcare providers. The goal is to help providers recognize unconscious bias, improve communication, and make sure every patient feels respected and heard throughout their process. Also, establishing a trust between patient and provider. None of this could happen though without our community partnerships. By working with local hospitals, prenatal clinics, OBGYN providers, WIC offices, churches, nonprofit organizations, the list could literally go on and on. We can connect these women with services that already exist in the community and make them a lot easier to access. Now
I'll be talking about the feedback. Feedback from our peers helps strengthen our program by confirming that our focus on African American maternal health disparities were not only important but relevant. Reviewers highlighted strengths such as our emphasis on community support, provider education, and culturally responsive care. Based on this feedback, we expanded our project by adding more details about implementations, evaluation methods, and how stakeholders' feedback will continue improving the program. Lastly, I'll be talking about the process evaluation. The process evaluation will determine whether our program activities are being implemented as planned. We will monitor navigator services through participant records, referrals, and appointment assistance. Workshop success will be measured through attendance and participant feedback. Provider training completion rates will be tracked to ensure we meet our goal of 90% participation. And finally, patient surveys will help us understand women's experience and identify opportunities for improvement.
One thing we really wanted to focus on was making sure that the women in our program actually have a voice, though. After every prenatal visit, participants would complete a short patient feedback survey about their experience. Every 3 months, our team would review those surveys during quality improvement meetings to identify the obstacles, improve communication, and make changes based on what the feedback we get from these patients. Instead of assuming what the community needs, we're allowing the community to help shape us over time. We'll also work closely with community organizations and churches because they already have trusted relationships with families. Those partnerships can help us reach more women and continue improving the program. This is important because patient feedback helps us identify all the obstacles to care that providers may not notice on their own. It also improves trust, strengthens accountability, and helps healthcare providers make more culturally responsive and sensitive improvements and choices. When people feel respected and included in their healthcare decisions, they're much more likely to keep back and come attending to appointments and wanting to be a part of this process, and they engage throughout their entire pregnancy.
The sustainability plan. To help ensure the program continues after the initial implementation, responsibility will be transitioned to local hospitals, prenatal clinics, and community organizations. Existing community health workers, patient navigators, or trained staff members from partner organizations will be prepared to take on the role of community maternal health navigators so the program can continue without relying on the original project team. Community partners such as local churches, Healthy Mothers, Healthy Babies Georgia, March of Dimes, and county health departments will continue providing education, outreach, and referrals to pregnant women in the community. Participating healthcare organizations will also make implicit bias and cultural competency training a required part of their annual staff education to ensure providers continue delivering equitable, patient-centered care. Patient feedback surveys and quarterly quality improvement meetings will remain in place to monitor the program's success and identify areas for improvement. By building the program into existing healthcare systems and community organizations, it can continue providing support, improving access to prenatal care, and making a lasting positive impact on maternal health outcomes.
Our expected outcomes are divided into short term, intermediate, and long term because we know that meaningful change just doesn't happen overnight. In the short term, we hope women become more aware of the importance of receiving prenatal care during their first trimester and begin using prenatal care during the first trimester earlier on to their pregnancy. We also want participants to gain a better understanding of healthy pregnancy practices and in the community resources available to them during this time. Also, joining enrollments like WIC, Medicaid, nutrition programs, mental health services. At the same time, we expect healthcare providers to strengthen their knowledge of implicit bias and culturally responsive care through annual training. Our intermediate outcomes focus on what happens as the program continues. We expect to see higher participation in prenatal care, increased enrollment in the programs like WIC and Medicaid, stronger communication and trust between patient and providers, and improved patient satisfaction. As women receive consistent care and feel more supported, they're more likely to continue attending these appointments and speaking up and trusting their providers, which can lead to healthier outcomes. Our long-term goal is to reduce the racial disparities in maternal mortality among African American women by improving access to equitable, high-quality prenatal care. We also hope to improve both maternal and infant health outcomes.